Health Canada has officially authorized the Pfizer BioNtech Comirnaty COVID booster for 5 to 11-year-olds. But why? Tamara Ugolini here for Rebel News, informing you that as of August 19th, Health Canada has authorized the first COVID-19 booster shot, the third dose of this injection, for children aged 5 to 11. Citing that a booster dose restores protection that has waned over time, the agency asserts that the Pfizer BioNtech Comirnaty COVID vaccine is safe and provides good protection against severe illness, hospitalization, and death due to COVID-19. As other countries suspend this injection program for youth, like in Denmark, as of July 1st, it is no longer possible for youth to get COVID injections except in very rare situations where a child is at increased risk of severe infection. Likewise, in Uruguay, a judge has ordered an injunction against the program for those under the age of 13 after the government failed to disclose the pharmaceutical contracts between themselves and Pfizer, and the chemical composition of the injection was not provided. But here in Canada, our Chief Public Health Officer, Theresa Tam, announces the extended emergency use authorization that prioritizes children with an underlying condition.
Specifically, NACI recommends that children 5 to 11 years of age who have an underlying medical condition that places them at high risk of severe illness due to COVID-19, including children who are immunocompromised, should be offered a first booster dose of the 10 microgram Pfizer BioNtech Comirnaty COVID-19 vaccine at least 6 months after completion of a primary series.
This comes despite the filibustering of my access to information requests that sought the risk versus benefit calculation, that's it, used to justify this injection in adolescents aged 17 and under. It's an authorization that continues to be rubber stamped and filtered down to our youngest and most unable to advocate for themselves demographics. As reported by Blacklocks, there is hybrid immunity in elementary school children due to natural COVID infection. The report sources an advisory committee statement from the National Advisory Committee on Immunization, that's NACI, on the recommendations of the booster doses in children aged 5 to 11. In the report, NACI has provided recommendations on planning considerations for a fall 2022 COVID-19 vaccine booster program in Canada, and confirms that as of July 17, 2022, 42% of the population aged 5 to 11 in Canada is vaccinated with a primary series, that's 2 doses. Hybrid immunity, which they call protection due to a combination of both infection and appropriate vaccination, has increased as many Canadians, particularly young Canadians, have now been infected with SARS-CoV-2. NACI makes these recommendations to minimize serious illness and death while minimizing societal disruption as a result of the COVID-19 pandemic, and to transition away from the crisis phase toward a more sustainable approach to long-term management of COVID-19. All of this comes as real-world data continues to contradict the shifting goalpost narrative that these injections prevent serious illness and death. Data analyst Kelly Brown takes Ontario public health data and dissects it. Recently, he has found that especially in those aged 60 and up, of which the boosters, including 3rd and 4th doses, which were originally authorized for these considered high risk in the fall of 2021, are the ones being hospitalized. And in Ontario, deaths in the boosted and double boosted now tower over those with only 0 to 2 doses. And it appears that people are waking up to this phenomenon as COVID-19 vaccine uptake for the youngest demographics is at an all-time low. Here in Canada, 55% of the 5 to 11-year-olds that are eligible are vaccinated with 1 dose and 42% with 2 doses. Already, 0.07% have received 1 booster. This pales in comparison to a mere 2.5% of those aged 4 and under who have only received 1 dose, and 0.03% with the 2 doses, apparently 0.01% with a booster, despite there not being an authorization in place. For booster doses, the trend also continues downward, with just under 50% of the entire Canadian population having received the third novel injection. That is a lot of anti-vaxxers. Some refer to this situation as being a result of disastrous public relations by the Public Health Agency of Canada and Health Canada throughout the COVID narrative. An agency led by Theresa Tam, who flip-flopped on public health advice from the onset and utilizes behavioral modification techniques to gain compliance of the Canadian public.
We have our own applications too that nudges people or reward them for healthy behaviors or giving them badges or these kind of rewards. And I don't see people doing that research as much as we would like. So maybe I'll turn it back to chief science officers to see if they can help. But I think regulation of social media platforms is the one that governments have been really engaged in, and that's quite a massive piece of space of regulation that is still undergoing debate.
For Rebel News, I'm Tamara Ugolini. We continue to fight vaccine passports in conjunction with the registered charity called the Democracy Fund. If you visit our website at fightvaccinepassports.com, there you can donate if you're able to help crowdfund legal defense for onboarded clients. And you can also check up on all of our reports on the topic at fightvaccinepassports.com.